Thank you. Our disclosures are the same. So we know well that pelvic floor disorders impact women's quality of life and well-being. Women often report changing behaviors to cope with pelvic floor disorders, such things as wearing pads, avoiding certain foods or beverages, only wearing dark clothing, bringing a change of clothes, and avoiding physical activity or social activity. We're still understanding how these behaviors relate to symptom bother. Our aim here was to describe the behavioral adaptations used by women with symptomatic pelvic organ prolapse and to assess their changes following surgical treatment. This is analysis of the same prospective cohort study of women with symptomatic prolapse undergoing surgery that I presented earlier. The primary outcome in this case and in this analysis was the Adaptive Behavior Index, or ABI. The ABI was developed by the Pelvic Floor Disorders Network, is a 17-item self-administered questionnaire with 2 domains, avoidance and hygiene. It is validated in women with pelvic floor disorders. Of the 275 women enrolled, 157 had complete adaptation data for all the time points and are included in this analysis. The demographics are similar. These are the median adaptation scores for the hygiene domain and avoidance domain at baseline 3 and 6 months. Scores in both domains decreased significantly following prolapse surgery. Here, the graph on the left depicts 3-month UDI scores in subjects with improved versus not improved avoidance domain scores. And on the right are the 3-month UIQ scores, which were significantly lower in women with decreased avoidance adaptations. These are similar comparisons at 3 months in UDI and UIQ scores by the hygiene domain, which were both significantly different. We examined the percentages of subjects with improvement in individual questions in the avoidance domain. 50% or more of subjects had decreased adaptations in needing to urinate whenever possible, avoiding standing for long periods, limiting physical activity, and drinking less fluids. And in the hygiene domain, 50% had improvement and responded in I always know and locate the nearest restroom, with 49% also using fewer sanitary napkins. In women undergoing surgery for prolapse, Adaptive Behavior Index scores improve following surgical treatment. The greatest improvements relate to urinary symptoms and physical activity. Future studies are needed to better understand the factors that contribute to the lack of change in the adaptive behaviors following surgery. Thank you very much, and I welcome your questions.
Thank you, Chiara. So this paper is now open for questions. Maybe I could start. Something we tend to see, and I think this is reflected in your data, is that very often women will continue to wear pads for protection just in case, and I think that's something you've shown. I'm surprised that many of these get better so quickly after surgery, because very often it takes much longer for patients to adapt.
Well, this was 3 months, so hopefully by that point they will have begun adapting, but I too see the same thing where patients will continue to wear or continue to cope, and so using those coping behaviors. And I don't know if they've become dependent and then what it will take to change those. And that's what is really interesting, is to try to understand those who do not change those behaviors following surgery.
Yes, question?
Pedroletti, Södersjukhuset, Stockholm. I had a question in the same area, really. I was wondering about avoidance behavior. Do you think that you would get other answers if you ask the questions later on? Because this behavior need time to change, don't you think?
Yes, so we'll plan to look at the 6 months and 12 months as well.
6 and 12 months.
Yes.
Looking forward to that.
Thank you.
Very nice presentations. Do you think anxiety has had something to do about this for the behavior that continues after the operation? And if so, did you show any correlation with anxiety in those patients?
We haven't looked at the correlation between the adaptations and the anxiety, but what is challenging here, of course, is that all of these are very interrelated factors, whether it's adaptation or sleep, anxiety, depression, and trying to sort out all of those relationships is very challenging. But I agree, the anxiety can be a part of why those adaptations are not let go. Yeah.
I have one question also. Now, you are probably familiar with John Wise' validation of the Adaptive Behavior
Yeah.
Index. And he found that actually after pure prolapse surgery, he didn't see any change in the adaptive behavior index, only in the patients with urinary
urinary
incontinence. And you had 15% with urinary incontinence. Did you look at the difference of the two groups?
For the avoidance domain, there was no difference in the subjects who, between the improved and unimproved, in the number of urinary incontinence procedures that were done simultaneously. However, in the hygiene domain, there was a difference where there were more subjects who had incontinence surgery in the improved group. Thank you very much.
Lovely. Thank you very much.